Hi everyone, I am Karen Hoffman and today I will be presenting the subject of data quality in electronic health records. I'd like to introduce the subject by saying electronic health records and health information technology are on the rise. We as professionals must ensure that as HIT increases, data quality does not. I have a few objectives I would like to cover. Those would be to define electronic health records and data quality, to discuss why data quality is important in electronic health records, to examine characteristics of quality data, to go over common EHR mistakes, and ways to ensure data in the EHR preserves its integrity. There are two definitions that are significant for this discussion. EHRs, electronic health records, are an electronic record of health-related information on an individual that conforms to nationally recognized standards and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. Data quality is the reliability and effectiveness of data for its intended uses in operations, decision-making, and planning, and those definitions came from the Latour Health Information Management book. Why is data quality important? Data quality is important because it can mean the difference between life and death. If data quality is poor and there are missing elements, medical mistakes can be made. An example would be if a nurse gave a patient a medication but failed to document it, and then another nurse came in later and gave the patient the same medication and did not know if the person had already taken it, and this could cause a significant medical emergency. Also, bad quality data can result in bad research results. A lot of research comes from patient medical records, so if the information is incorrect, then the research will not be accurate. Good quality data can ensure patients get better quality care. When all the information is accurate and complete, the doctor is able to treat the patient better because they have the full story of their medical history. There are 10 characteristics that AHIMA believes gives quality to data. The first one is accuracy, which is the correctness of data. An example would be making sure that the demographic info or information given by a patient during their visit matches what's already in the record. Accessibility is the ability to obtain the data needed. An example would be the provider being able to access all of the patient record when they need it, but also making sure unauthorized users are not able to access this information. Comprehensiveness means that all necessary data is included. This means that all of the patient's past and present information should be included in their record. Consistency. This is the data, or when the data should be the same across all applications. If the patient has an allergy, it should be documented throughout the EHR in the same way. It should say it the same everywhere so that no matter where the doctor or the provider looks, it'll say the same thing. Currency is when the data should always be up to date. Each time a patient is seen, their information should be confirmed and or updated. Definition. This is data when data should be clearly defined so that users are clear on its meaning. An example would be having clear guidelines for what should be included in the patient's history and physical so that it can be documented accurately. Granularity is data that cannot be further subdivided. So in an EHR, if you're putting in a patient's date of birth, you would put it in as one attribute, month, date, or month, day, and year. That's the smallest granularity you can get for that. You wouldn't record them as 3 separate attributes as month separate, day separate, and month separate. You would record them as all one. Precision is the data value that's large enough to support the application. In an EHR, if a physician was using e-prescribing, when they were figuring the dosage, they would need to be as precise as possible. If they're prescribing a medication in milligrams, they would want to round up to the nearest milligram to be as precise as they could. Relevancy means that the data is relevant to the purpose. If a provider was seeing a patient, you wouldn't want to ask them what their favorite color was or what they did this weekend. That would not be relevant. Getting information about the patient's health, about what's going on with them, and things like that, that would be relevant. Timeliness. Timeliness means recording data in a timely manner. A good example of this would be making sure that the history and physical is done on time, the discharge summary is done on time, and also a medical coder coding the patient's visit from their EHR in a timely manner in order to get reimbursement. Electronic health records and data quality. One of the articles said the EHR should facilitate, not hinder, communication between health professionals and support their decision making regarding diagnosing, testing, and treating patients. In this fast-paced industry, sometimes professionals do not pay enough attention to detail in order to get more done. By doing this, not only the patient but the whole industry suffers. Quality of data should always be a priority. There are many mistakes that can happen in order to affect the quality of data. The first one would be EHR design flaws. Some EHRs may have glitches, and this could inaccurately record certain things in the medical record, such as a patient's allergies or medication. Also, poor system usability. If a EHR system is not user-friendly, then it could allow the end users to make mistakes. Incorrect information capture is another one. Sometimes there are different things like copy and paste and assist with documentation that may seem beneficial, but they can lead to inaccurate documentation and can lead to medical errors if someone does not know how to use them correctly or overuses them at the wrong times. Also templates. Sometimes people may use templates in order for a shortcut, but they may not tell the whole story, or you could get similar or identical content and then the data quality is poor. There are also clinical decision support errors. It may lead to errors of omission. The system may not prompt end users to notice important information, so they do what the system tells them and ignore the training that they've had. Here are some ways to preserve data quality. Reducing EHR design flaws. Improving the EHR design and reducing features that cause errors can help improve the data quality of the system. Improving the system usability by finding applications that finding the applications that increase patient harm by errors, and they should be assessed and reassessed, and the quality and safety measures should be put into place. Improving documentation capture. EHR content standards should be defined, guidelines for vendors and users should be developed, and policies and procedures should be put into place. To minimize clinical decision support errors, there would need to be an implementation process that minimizes the risk of patient harm, and users would need to be trained more properly. And the last thing would be to double check. Anytime documentation is done, the end user should always double check what they're putting in to make sure that it is accurate. And here are my resources. Thank you very much.